A lot of people call us and they want to know what are the difference between composite veneers and porcelain veneers. So today we'll cover all of that, and we'll also go over the pricing. First and foremost, let's just make it easy to understand what is composite. Composite is a white filling material that a dentist can use to fill a hole if you have a cavity. If your teeth are a little short, composite is now being used to allow the dentist to enhance aesthetics. So if you have short teeth, we can make them a little longer. If your teeth are a little too rounded and you want to make it a little squarish, composite can be added to the edges and it can create that look that you're trying to go for. It gets the job done. It can change the overall shape and size, but I feel like it has its limitations. On the other end, what is porcelain veneers? So porcelain is actual material that is more like glass. It is much stronger, I would say, than composite. It's made outside the mouth, so a dentist and a ceramist, the laboratory can add a lot more details to it. So if you wanted to make it a very translucent looking veneers, if you wanted a specific shape and size, you have a more control over being able to get exactly the details that you want to add to your porcelain work. Versus composites, sometimes you're limited with the amount of details you can add. Cost wise, how much do they cost? Composite will be definitely cheaper because it's made in one visit, so there's less time a dentist will be spending on you overall. So composite veneers can range anywhere from $1,000 to $1,500, I would say, and porcelain veneers can range anywhere from like $1,400 to maybe $4,000. In our practice, our veneers starts around $1,400 and it can go up to $2,000, $2,500 depending on the severity of the case. Pros and cons. Composites tend to be strong enough to be able to bite into food and stuff, but I have noticed that, at least in my opinion, that it do tend to chip very easily. So if you bit into the fork by mistake, maybe that filling or that veneer that you have to make your tooth a little longer may come off. Versus a porcelain is glued on very securely with the cement, and it does a better job at staying on. I don't have that many cases where a patient has their porcelain veneer come loose, versus a composite sometimes needs to be replaced every 7 to 10 years. Porcelain can last much longer than that. It can last maybe 20 to 30 years. Both requires the same oral hygiene. You need to brush properly, floss properly, go visit your dentist regularly, because just having composite veneers or porcelain veneer does not mean you're not gonna get cavities. So still requires the same maintenance that you will normally need for your regular teeth. Nothing new that you need to do. Things that you can do to maybe make your veneers last longer. I would say wearing a night guard is one of the most important things that I like to have my patients wear, whether you are doing composites or porcelain veneers or not doing veneers at all. Wearing a night guard at nighttime, or a retainer at least, will make your teeth look younger for years and years to come. So if you want to make sure that your teeth don't age, please wear a night guard. You will thank me 20 years from now.